This segment of Delmarva Life is brought to you by Tidal Health.
Hi, I'm Dr. William Duran, orthopedic surgeon at Tidal Health, and I need to tell you it's showtime.
Listen, anytime you come across a doctor that has a stellar sense of humor like that, you keep them handy. Tidal Health Nanticoke, Dr. William Duran, already introduced him the last time, as you just saw, with that spectacular It's Showtime, and thank you again, by the way, for that, is joining us today in historic Studio D. Thank you so much for being in here today.
It's my pleasure.
It's wonderful having you. So,
Excellent.
I want to talk to you a little bit about this robotic arm surgery, and we talked to you a little bit about it before, and I say it correctly for me because it's a robotic assisted.
Mako robotic arm assisted surgery.
Okay, so
the robot's easier.
The robot's easier. Thank you for that. I appreciate that. So this is a remarkable piece of technology. Tell me just real quick about it again so we know what we're talking about.
So in a nutshell, it is a piece of equipment about the size of a shopping cart that has an arm that comes over and allows for very precise surgical procedure to be performed for total hip surgery,
right,
for partial knee surgery, and for total knee surgery.
It does the actual thing. You direct it to do the actual thing.
It allows for precision cuts, but it can't operate without me pulling a trigger. Yeah.
How long have you been a surgeon now?
I've been a surgeon here in the Delmarva Peninsula for 5 years.
Did you ever think that you would see technology like this come in?
Yes.
Really?
Yes, I did. We knew that technology was growing and that robots would be a part of it. They've been using it in the abdomen, and now we have the opportunity to use it for joint replacement to provide very precise procedures for individuals.
What's it like for you to control the robot, to work with the robot to do that?
It's nice because the outcomes are incredibly predictable, because prior to surgery, before we ever actually make a cut, we have the opportunity to know exactly where the implants are going to go at the end of the procedure, and balancing, which could be a very challenging experience, has all but become straightforward, right? And that makes a difference for the long-term outcome for people.
You brought some models with you. We're going to get a shot of those. Tell me about these models. And this is the kind of thing that this robot assists with.
Correct. So this one is the hip arthroplasty, or the hip replacement. And so the robot helps me, particularly as I put in the acetabulum. The acetabulum is this component right here, which allows for the implant to articulate with. So
what I would call the cup.
So what you'd call the cup, correct. So it helps put the cup in a very appropriate position, which decreases risks for dislocation. The one in the middle is the partial knee replacement, which is an excellent opportunity, procedure for someone who qualifies for it, but you only can have an area of one part of the knee being diseased. If the entire knee is diseased, we would use the total knee replacement. And the total knee replacement just gives a complete coverage, removal of bad cartilage, and then long-term outcomes.
And you can do all of these with the assistance of the robot.
Correct.
What got you first interested in medicine and orthopedics?
So it's a two-part question. I got interested in medicine when I was 11 years old. I was sick with pneumonia. I was in the hospital. And I remember my doctors speaking a language that I didn't understand, and I was driven to understand it so that I could be in a position for my patients to not feel like they would be in that same spot of not understanding that medicine talk. So when I talk to patients, I talk to them in words that they understand, because that's what they want to know. They want to walk away in that sense. And so that's what got me into the idea of medicine. And later, when I was in high school, I worked and wrestling with a surgeon, Nelson Wigman, who just recently retired, who was like, "What do you want to do with your life?" I said, "I want to be a doctor." He was like, "Come to my office," because we had hit it off. He invited me to go to the hospital. Times were a little bit different. I went with him. A lady needed a bone put back in place. He used me as counter traction. I was like, "This is it. This is for me," right? And so I then went with him to a surgery. It was spine surgery, and I thought to myself, "This isn't making me sick. I'm all in," right? And so from that point forward, it was my goal from, as I finished high school, all through undergrad, through medical school, to be an orthopedic surgeon.
So it's not just a matter of doing something cool with the robot and things that most people don't do, but you're actually interested in the patient as well.
I think it's the most important part of it. I mean, I do enjoy the, there's a level of instant gratification in orthopedics, which is one of the other reasons that, drove me to it. I watched this lady with a bone in the wrong position. We straightened her up, and even though she wasn't immediately fixed, her pain level substantially dropped. And I've had that opportunity many times to give an instant gratification. There is a level of a recovery, but still people get better, and that's very exciting.
That's amazing. Tidal Health, Nanticoke, Dr. William Durant, thank you so much
It's my pleasure.
for talking to us today.